The exciting thing for me about coming to Roswell Park was that everyone here was very, very excited about integrative medicine. Everybody's been very excited about the acupuncture program. All of the oncologists have been on board with this. They have identified to me patients that are probably some of their sickest patients and most challenging patients. And with very little intervention, a treatment, 2 treatments, that we're really seeing some incremental improvements with the types of side effects and symptoms that were really the most troublesome. So basically, when I meet a patient for the first time, what we do is we talk about their main complaints. You know, do they have any pain? Do they have any nausea? That sort of thing. And then I also do a little bit of a history just to find out what other things are going on with them. And then I take a look at their tongue, which gives me information about what's going on internally. And then I also take their pulses from a Chinese medicine perspective, and that also gives me more information about what's going on with their energy. And then based upon that, then I make a diagnosis, treatment principle, and then pick the points that I'm going to do to help to balance out their energy. So I'm going to do 1 point on each leg, here and here, just below your knee, and then I'm going to do 1 point here and here, just above your ankle. Okay? There's a whole system of pathways in the body that we call meridians, and that's where the qi flows. They don't have a direct correlation with any of the other systems in the body in terms of like the circulatory system or the nervous system or that sort of thing. They're their own system of pathways. And this substance that we really can't see, but we can feel and assess, this qi, flows through there. And what happens is that some areas we have too much qi, some areas we don't have enough qi. So basically, by accessing certain points on the body, there are 365 regular points on the body, each with a specific function and indication, that by accessing that particular point, it tells the body to do a specific thing, either to move energy here, take away energy here, that sort of thing. All the needles are pre-sterilized single-use disposable needles. So the needle comes out of the package sterile. There is a guide tube around the needle, which helps with the point, being very exact about point location and then ease of insertion. The guide tube is rested against the skin. Tap the needle, and that's when the needle is inserted. And then the guide tube is withdrawn, and then the needle is left in place for about 15 to 20 minutes. So acupuncture is virtually pain-free. So basically what happens is, because the needle is a solid tip needle as opposed to a hollow tip needle, when it's inserted, it pushes the tissue aside as opposed to cutting through as a hypodermic would. Also, because the insertion is very quick, what happens is the needle passes through the pain receptors, which are at the surface of the body, and the body does not even register that there has been anything inserted. It's very important to have complementary care in the form of integrative medicine to help support the body. So, and that's really what I'm concerned with when I do acupuncture, particularly with oncology patients, because it's very, very important that they get their treatment, right? That they get their surgery, that they get their radiation, that they get their chemotherapy. But what happens is, because all of these procedures may have some sort of side effect with them, which can actually weaken the patient further, can also prevent them from having certain types of treatment, can prevent them from recovering as quickly as they should, that by adding acupuncture and other alternative therapies into the mix, you're supporting the body of the patient. So where the medications, the radiation, the surgery, that sort of thing is helping to eradicate the disease, we also need something on the other end to help the patient to be able to tolerate the procedures that they've been through, recover faster, recover better, and then come out on the other side stronger and able to go on with their life.